the years, MS TeamWorks has shared perspectives on MS from all members of the MS team. And although 2020 brought unexpected challenges, we were determined that a pandemic and social distancing would not stop us from sharing new and meaningful perspectives. The setting was different, but the message is the same. I have MS. I have a team. I have a future.
I'm Bob Shin. I'm a neurologist and neuro-ophthalmologist at MedStar Georgetown University Hospital. So I focus mostly on multiple sclerosis and other related disorders, but also kind of pay attention to vision as well.
Hello, my name is Lindsay Turner. I was diagnosed with relapse remission MS in 2016 at the age of 25. As a 25-year-old, most can imagine this was scary. There were so many questions that I had and wanted to ensure I would live a quality life. Dr. Shin has helped along the way and has reassured every what-if scenario I have ever had. With lots of research and support, I can say that if you knew me, you would have no idea that I have MS. I continue to focus on my health and chasing my dreams.
Well, one of the main considerations for people with MS who are considering having a baby is figuring out how to conceive and work that in with MS therapies. So that requires a lot of actual coordination between the healthcare providers and the patient, really whether men or women, in terms of trying to figure out timing and if any adjustments need to be made in medications. So Ms. Turner, I don't know if you remember really when we first started talking about this issue. I think you would approach me and let me know that you were thinking about working on having a baby. Do you remember what kinds of issues were on your mind or what kind of things you were concerned about?
Yes, absolutely. I remember it was in April, actually. We did a telehealth call, super helpful. When I first came to you about starting a family, my main concern was my current treatment. What I was currently taking is considered a very safe medicine, and Dr. Shin advised that I could stay on the medicine, but for my personal decision, I decided to quit taking my medicine before getting pregnant, and that is something that Dr. Shin did support me on. Some of the factors that we took into consideration were the severity of my MS relapse, my personal medical history, and my current treatment. As most have heard, when a relapse remission patient is pregnant, they are typically in remission, so that did make me feel better. Knowing that this without medicine. My other concern was after pregnancy. Was I going to have to get on medicine right away? What if something came up during pregnancy? And Dr. Shin reassured me that we will tackle those situations if or when they happened. So he really put my mind at ease and provided me with the support.
Yeah, well, those questions actually come up a lot when we have these conversations. So I think, as you kind of mentioned, the first thing I usually do try to reassure patients is that, interestingly, for women with MS who are pregnant, somehow it kind of seems like they're protected from MS during that time period. So that makes the need to really treat people during pregnancy not as critical. The other challenge, though, is how about with conception? So I think, as you kind of mentioned, there are some MS medicines that we think possibly could be safer than others. A lot of that's really just based on animal studies. So we don't really know in humans. But I think as in general principle, most of my patients prefer, I think as in your case, to try to get pregnant not being on MS medicine. And that leads to other conversations because figuring out how to do that varies basically by treatment options. So some require a little bit more care in getting off of the medicine. Some MS medicines actually need to be actively cleared out of the body. Others you can just stop and work on that. And then as you also mentioned, the last issue is, of course, well, how about after you've had the baby, then what? And that actually is a little bit more unknown in that we used to say that, well, women with MS are kind of protected during pregnancy, but after they have their baby, they might have an increased risk of having an attack, which sounds a little bit scary. But actually, there is some more recent research that says that might not actually be true. But I think, as you said, I guess we decided we'll just deal with it if and when we have to. because I think having the baby is so important. I think for most women, or many women, breastfeeding is very important. And usually I would say we recommend staying off medicine even during breastfeeding, because again, why take chances? And then plan to get back on therapy once the baby's weaned. So in a way, I was kind of glad we were able to have that conversation and cover all of those issues.
I relied on Dr. Shin for all my worries and questions about planning a pregnancy. We had a virtual telehealth call, as discussed, about planning a pregnancy, and also MedStar has the great online portal where patients and doctors can communicate through messaging, which has been extremely helpful. He answered every single question without hesitation. And I would say some suggestions I have when planning a pregnancy as a patient with MS is to consult with your doctor first. Write down all the questions that you have, that way you are prepared. Ensure that you discuss treatment and what you are currently doing to prevent a relapse. Also, what Dr. Shin explained is that just because I have MS does not mean I will have a high-risk pregnancy, because that was another question that I had, so that's also a side note. I also suggest find an OBGYN or midwife who has experience with patients with MS. This has really helped me in that my OBGYN is very understanding. Dr. Shin reassured me that once the baby is born, we will reconvene and discuss the next steps, and that there are a variety of treatments for in-between pregnancies.
Yeah, I'm really so happy to hear that that worked out well for you, Ms. Turner, because I think communication is always the key, and frankly can be a challenge, especially during the sort of this year with the COVID-19 pandemic. So as Ms. Turner kind of mentioned, we've had to try to leverage technology, whether it was through telehealth visits, other kinds of interactions, as she mentioned, through our patient portal, which allows electronic communication. It's just been so important that we remain connected, even though we actually haven't seen each other face to face actually in a while. As you mentioned, timing for the future will be interesting. I actually kind of like it, to be honest with you, because a lot of times my women with MS who have their babies, they do come after they've delivered with their babies. So it's actually kind of fun, but they're often still breastfeeding, but that kind of visit lets us set the stage or lay out our strategy for how we're going to get back on therapy later. So, actually, as I'm thinking about it, I do miss some of our face-to-face visits for that reason.
Absolutely. I can't wait till I can see you one day, not for anything important or any issues, but just to come and visit.
Some additional tips I think I might recommend for people living with MS who are considering having their baby would be, if possible, kind of having a conversation about what that timing is going to look like. So I know sometimes it's a surprise, but sometimes couples will be planning out sort of what they're anticipating. And then as we know, getting pregnant isn't always a sure thing. So sometimes there has to be flexibility built into that table. And the reason that's important, as I mentioned, is that depending on the MS therapy someone might be on, we might have to make different approaches in terms of figuring out how to get off of that medication. But then also keeping in mind that the time that it might take to get pregnant might vary. You know, some people are lucky and they get pregnant right away, but sometimes it can take a longer period of time. And so making sure that we have a good sense of sort of what our time windows are like, I think is also very helpful. Ms. Turner already just brought up, as you can tell by just seeing her on screen, she's just she's a great communicator and she's not shy. And I think that is actually a great lesson or a great characteristic of hers, is that I know that if she has a concern, she's going to bring it to me and that we can sort of work on that together. So communication, again, is truly key.
I would say the main message is to not worry, stay positive, and if something arises, contact your MS doctor right away. As Dr. Shin said, communication is huge, so ensure that you have that great communication with your doctor. And just because you have MS does not mean you will not have a healthy baby and a smooth pregnancy, as well as MS is not something that is hereditary, so that's something that you should not have to worry about. MS is something that you have, but not who you are. Also, like I said, just continue to stay in contact with your doctor and, build that relationship with them and let them know where you're at with planning a pregnancy.
Actually, Ms. Turner brought up a great point that we didn't cover earlier, but I do get a lot of questions about whether MS is hereditary, or I think especially for young women who are interested in having a family, they're worried. They wonder, would I give it to my child possibly? And as Ms. Turner said, at least my response always is that MS isn't really directly inherited. So for my patients who have MS, it doesn't mean that their mother or father gave it to them directly. But I do let them know that we do know that if you have a first-degree family member, a parent or a sibling with MS, your risk of MS is a little bit higher than, let's say, my risk as an Asian American with no MS in my family. But we're talking about really just maybe a couple % risk. So usually I do say, if you have MS and if you're going to have, let's say, 30 children, I think, there is a chance one of your children might have MS. But in general, this, again, it isn't something that's going to be directly passed on. Now, as far as sort of a take-home message from this talk, I think the main thing would be that, people who live with MS make so many compromises in their lives because of the MS, whether it's time off from work to go to doctor's visits, whether it's, starting a new medication or having to spend time, in the office in order to get those treatments. But I feel like something like having a child is such an important decision in any person's life. That we want to really minimize the impact the MS has on that decision making. So from my point of view, I feel like when people are thinking about having a child, the timing of it in their lives, how many children they want to have, I feel like MS shouldn't really be a part of that decision making. That's a very personal decision between two people. And I think that MS should for the most part, stay out. So then I see my role really is making sure MS stays out of the way. So figuring out how a couple can achieve their goals with really minimal impact from having to take care of their MS. And I think, again, with communication, this is definitely achievable.